Good afternoon, everyone, and welcome to today's PracticeHub Facebook Live event. Thank you for joining us. We're running a little bit late today, but thank you for your time. So today's discussion is going to be an overview of continuity of care and clinical handover policies and procedures. Now, my name's Anna-Maria Gibb. I'm the Senior Product Manager here at PracticeHub, and part of my role involves ensuring that our policy and procedure templates are aligned with the ever-changing needs of healthcare practices. Now, those of you in general practice land will know that continuity of care and clinical handover are two of the areas covered by the RAC-GP standards. If you are not in general practice, I think this information is still really relevant because these sorts of areas are critical to patient care, safe patient care, and also from a risk management perspective for you in your practices. So if you're in specialist, dental or allied health, I think you'll also find the information today really useful. Now, as usual with these things, I normally talk about why we create policies and procedures, what's the difference between a policy and what's the difference and a procedure. And first of all, I think it's really important that they need to be meaningful to the people using them. They need to be understood and they need to be able to be followed. So they need to be practical. So the procedures in particular are the how-to section. So let's have a look at when we develop a policy, what should it cover? Well, I think a policy should talk about the reason the policy is required and why it's important. And some of the reasons why policies are required and important include things like compliance. So we're thinking about legislation, regulations, as I mentioned before, in the standards and other guidelines. And another good example of that is privacy. So we know there are a number of reasons why in privacy policies and procedures are important. Another reason a policy is important is to help with patient safety. So it's really clear about the reason we do this, we have this policy, is that it's to help with patient safety. Another reason is for risk minimization. If we have this information documented and the steps and the procedures that we're going to follow, we will minimize risks of something occurring or something being done in a way that is not best practice. So the types of risks you're thinking about are clinical risks, safety, and business. And the two policies we're talking about today particularly focus on clinical risk. And the fourth reason is what I think of as operational excellence. So it's basically thinking about the processes, the roles, and the responsibilities that are assigned to people, or the way things will be done that promote efficiency as well in your practice. Now, moving on to procedures. Procedures are all about by who, when, how often things are going to be done. And you need to ensure that all the musts are covered in this. And importantly, I think with policies and procedures, it's important to be able to cross-reference with other policies and procedures because they rarely live in a vacuum. So, you know, things today, even today's policies, are very interconnected. If you're thinking about something like privacy, you would connect that, cross-reference that with things like your code of conduct, maybe medical records, those sorts of things. And the third component that I think, after you have your policy and your procedure, the third component I think you really need to have are references and resources. And these are really important because they're other sources that support information in your policy and procedure. And some of the things I think work really well are articles and case studies, because they give that kind of lived experience to the policy and procedure and make it relatable to your readers and to your team. And links to those regulations and guidelines can also be really helpful as well in terms of why we do what we do. All right, so hopefully while you've been listening to me talk about the background to policies and procedures, you've also been having a look here at our PracticeHub dashboard. And so you can see we do have many different applications that form the whole platform. If you're an existing PracticeHub user, you'll probably recognize a lot of them. Some of them you may not have done a lot with yet. If in doubt, always give us a call and we can talk you through some of these. If you're new to PracticeHub, it gives you an idea of how comprehensive our suite of applications is. So let's go over to our policy and procedures manual. Now, one of the things we do in PracticeHub is we can provide our customers with a suite of policy and procedure templates that cover all aspects of managing the practice, and in particular align with whichever standards are relevant to your practice. So the template I'm using today is the GP one, but again, as I said earlier, it's still very relevant to any type of practice. So let's have a look at continuity of care. So we know that this policy is related to standard GP 2.1 in the RAC GP standards. Our policy is very much, as I said earlier, that kind of overview, why we do what we do. And this aligns very much with the standards as well. And then it's the procedure where we have sort of examples of how do we implement, how do we demonstrate our processes for continuity of care. And so there'll be things like we confirm the patient's regular GP or practitioner when they book an appointment. If that GP is not available, we suggest another GP. That if their patient leaves the practice, we send a health summary to the new healthcare professional. If it requires ongoing management, so particularly for your patients with complex and chronic conditions, you'll probably have multiple healthcare professionals involved in their care, and that you basically provide the correct information. Now, I feel probably at one point I'm kind of sort of telling you what you already know and do. But my real purpose here today is to sort of suggest that even though you're probably doing all of these things really well, I think it's important to ask yourselves, have you documented this? Because a new person will come to the practice. And if some of these things aren't documented and passed on, there's more chance of them not following your preferred processes or the required processes as well. So I think it's really important. I'm not suggesting that people aren't doing this well. I think most practices do this well. It's a case of, are you documenting it? When you have handover to new staff or people changing roles, can they access this information so they're really clear about what the requirements are? So on this page, here we have this example of what this means in practice as well. And that does align for those of you who know your standards. You'll know that this aligns pretty closely with what the section on how to meet this criterion, what it actually states in there as well. It also states in there that you do need to have a clinical handover system. So I feel that these are two very related policies. Now, if you were a user in PracticeHub, I would simply add a section here, and I will talk to you about that red banner in a second. And I just would generally write something like related, and then I can cross-reference this with my policy relating to clinical handover. So GP2, clinical handover. Going to put that there. So now I've got that cross-reference to the other policy that relates as well. Now, before I do nip over to clinical handover, you've probably noticed these red banners on the page as well. So one of the challenges you probably have is you develop or update a policy, you need to share it with the team, and ideally you also want to get sign-off that they've read and understood the policy. So I know a lot of practices will either hand around paper-based policies or they'll email it out to everyone and say, please sign off and send it back. Within PracticeHub, it's much simpler. You basically flag by role who needs to sign off on this policy, who is this relevant to, and then when you save and publish the policy, those users will see this notification on the page. You're required to read it as part of your induction or compliance. And then, of course, down the bottom, I have read and understood the contents and agree with its provisions. and the user clicks on confirm. And now you, as the manager or principal of the practice, have an audit trail of that sign off for compliance as well. If you go in and you make a significant change to the policy, you can simply send off a notification as part of the saving it process. And again, they'll get a notification, which is basically, hey, we've updated this policy. We need you to review it and sign off again that you've read it. So that makes that whole process sort of all within the application, and none of this kind of, sending out 20 emails, counting back 15 and wondering who the 5 are that are missing, and so on. So I think it's a really neat process and gives you that kind of peace of mind that people have read them and that they have confirmed they've understood. If there's any sort of deviation from the procedure, you can go back and say, hey, remember, you signed off on this policy back on the 1st of February, and it stated that you needed to do X, Y, and Z, but you didn't in this instance. Maybe if you could go back and review the policy. So I think it gives you that sort of ability to have that conversation with people more easily as well. Okay, let's have a look at, I've got to do my save. So here I was with my publish and notify. So as you can see, they'll be notified and they'll need to sign off. Oh. Comment in, and that's really useful for the audit trail, which will include the comments that I've added and any changes that were made. So again, that built-in audit trail is very useful. All right, so let's have a look at the clinical handover policy. And once again, I'll just sign off on that one. And this is a really good one. Again, this relates to, and again in PracticeHub, where possible, we link to the relevant standards. This is GP 2.4 and also Core 5.3. So there's 2 criterion that reference clinical handover in those standards. So once again, we have our policy, why we do what we do. And in this instance, we're also mentioning whose responsibility for various actions. And the procedure in this one, of course, we've broken this up into the internal transfer of care, external transfer, and emergency situations, and so on. And also the all-important parent and care involvement in clinical handover. So you can see that if you've documented all of this, it does make it easier for people to understand what is the process and what is not the process. So within your practice, your internal transfer of care, if a practitioner is going on leave for a month, who is going to manage their reviewing any results that come through? Is there some sort of process for who their patients will normally see? How will you handle that? So really important to document this information so that as everyone is clear, and then things don't kind of fall through the cracks as well. Now I see I have a couple of questions there. So are the policies and procedures the minimum standards that are recommended? I believe they definitely cover the minimum standards and probably even go a bit beyond. And again, if you think about my whole concept around why you have these policies, thinking about operational excellence, it's not just about meeting the standards in this instance, but think about what would be operational excellence for your practice when it comes to these 2 policies as well. Now, I see we also have another question about, is there an incident register in PracticeHub? There absolutely is. So let me show you. The quickest way to find that is just through my filter. So if I write register, you'll see here in our quality and risk systems category, we have an organisational wide register. And that covers, I like to break that up into your business risk, clinical risk, and safety risk. And so these are really simple processes for documenting your risks. It also links to a risk matrix, which I think is really useful, sort of thinking that through. So you can see we've got our likelihood and consequence, and then sort of what does that mean, the measures of risk there as well. But back to our register. So again, very simple register. You can see here, we've got some examples. We've had a needle stick injury. What do we need to change? And that sort of thing as well. Now, the question was, do we have an incident register? So yes, we do have an incident register as well. So basically, we're talking about what was the type of breach, what were the contributing causes, the impact, what existing controls did we have, and so on. Now, if I were a practice manager, you can set review dates for these things. So if I was a practice manager, I'd probably select to look at this register every month. So if you have monthly team meetings, you'd probably put something in here that says every month I want to be reminded to go in and have a look at this, see what's in there. Do I need to add anything? And then we can talk about the things that have been added in the past month at our next practice team meeting. So you start to develop that process of we document it, we review it, and then ultimately, if you make changes to your systems, you would document those in your quality improvement register as well. So if you've done something to improve as a result of an incident, as a result of a risk, as a result of patient feedback, you could add that information into your quality improvement register as well. And again, something to talk about at practice meetings. All right, we did start a bit late and I am conscious of the time. So let me just wrap up by saying that you can find more information about PracticeHub and these policies, and in fact, all of our suite of policies and procedures on our website. On the website, you can also book a demonstration. That's really the best way to have a look. The demonstration is one-on-one with you and one of our consultants, so they'll be talking about your situation. Good news for existing PracticeHub customers as well. You can now log into your PracticeHub site from our regular website. There's a login button that we've added after much feedback from our users asking for that, so it's now there. And other things to let you know. So many of our customers have been enjoying the benefits of a program called Rewards Plus, which is basically shopping and saving thanks to being a PracticeHub user. If you want more information about that, I believe there is a link in the Facebook discussion for this event, which will link you to a webinar being run by the Rewards Plus team around how to make the most of that, that loyalty program. If you are not seeing this on your PracticeHub dashboard, give us a call, or otherwise have a look at Need Help, where you will find some information about Rewards Plus, which we will add. So there is information, or give us a call. And finally, next week, we have a webinar on the ever popular topic around complaints management, being hosted by the excellent Mariana Kelly, a risk advisor with Avant, and myself, tying it all in with how to use PracticeHub in your complaints management processes. We don't have a Facebook Live event next month, so we will be back in May with some new policies to go through with you. Once again, thank you very much for your time. Any for more information, go to our website.